Hi, Dr. Kelly Starrett here for H-Wave. One of the questions that we're consistently asked is, how do I manage an acute injury before surgery? I think I'm going to need surgery, or I know I'm going to need surgery. What do I do before then? What we have come to realize that sitting and waiting around for surgery is not really a great use of our time. In fact, sometimes we see things that look like they need surgical interventions and ultimately don't, based on the conversation and the evaluation of the physician. What we want to do is be able to get to a place where we can have that conversation. So there's two things that we're always about. One is we absolutely have to give relief to the patients and athletes we're working for. So if we have an athlete who's just sprained their knee or strained their knee, we always tend to think this is worst case scenario. I've torn my ACL, I'm going to obviously need surgery. But oftentimes it's just a sprain, just like a turned ankle. But we can't really tell the severity or the nature what's going on, and I'm certainly not a physician, but part of my role is to get and manage swelling and to help my patients with their pain. And one of the things that we love about this H-Wave technology is that I have two very, very powerful modalities. So if I have sprained my knee, that we know that early mobilization or small range of motion in a pain-free way is crucial. But if my knee is highly effused and highly swollen, I can't really tell what's going on with the joint. That swelling can be the mechanism for why my brain is perceiving this to be so painful in the first place. And one of the things that I can control, even if I maybe have damage or I've actually disrupted some of the tissue inside the knee, is I absolutely can control my swelling. So what we know is that if I have a very, very swollen joint, that can be a mechanism for driving a lot of the severity of my pain, but also that's going to limit my healing. And that what we know is that as long as those tissues are under high pressure and diffusion as a normal reaction to the injury or the strain process, until I can get ahead of that swelling mechanism and begin to evacuate that swelling out, I really can't tell the loss of function, I can't tell what the range of motion is, and I can't sometimes even perceive what I think is going on in the joint potentially with special tests. So when we're thinking about that, we have two ideas again. One is that relief is the name of the game. And in high frequency, what we love to do is put one pad on either side of the joint. So I'll move the unit to a high frequency setting. And what I'll do is with this pad on either side of the joint, allow my patients to dial up to a comfortable position where they're actually going to get some relief through the joint system. And this is what we can kind of think of as a global treatment for pain mitigation. And what's nice then is that our athletes can really adjust this up and give themselves some momentary pause and momentary relief. We can actually inhibit some of the signaling from the tissue, which has clearly been challenged. We don't know the degree of the trauma, but that's not really sort of the case. In the short term, I can have some non-drug effects where I don't have to potentially use or ask my physician for prescription pain relief, but we can actually give them some pain relief that our athletes can control. And our basic rule is, hey, if you get about a 45-minute treatment with high frequency, give yourself a couple hours off. High frequency, couple hours off. And that oftentimes is enough to begin to break this acute pain cycle. And if you've ever been around someone with an injured limb, they are afraid to move it. Ooh, 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 splinting is going on. So anything we can do to help the brain perceive this as not as an immediate threat means that we've already started to dampen the psychological ringing bell of tissue trauma. Secondarily, and this is really important, is that we now have a mechanism to begin to remove the swelling from an injured site. And what's crucial about this early mobilization, so all I'm doing is switching to low frequency now, is that let me turn it off, switch to low frequency, and now my goal is to just set this up so that I have some kind of muscle contraction that doesn't cause me pain. So what's nice is that I absolutely could just flex the quadriceps myself for 6 to 8 hours. But what we find is that that's not very practicable. It's not very realistic for a person to actually actively contract their quadriceps. And when we have a swollen joint, oftentimes that quadriceps contraction is difficult. And the reason this is a problem is that if I can't contract the musculature above or below an injured site, or a site that's been strained, or a site that's been challenged and is now swelling, then it's difficult for me to evacuate the swelling out of that joint. unless I've got high levels of manual compression on here and I'm elevating the joint or elevating the tissue system. So what ends up happening is that I often left with athletes who are a few days after or immediately after the tissues are very swollen, and we're left with not very many good ways to remove that. And the old model that we've loved to adopt from our friends is that if you knew it was going to swell, or if you knew it was going to snow an inch an hour for the next 12 hours, you could easily go out and stay ahead of that snowfall on your step with just a broom. But if you wait till you have 12 inches of really, really heavy, dense snow, it's going to take us a minute longer. And in that time, we may have greater disconnection between being able to actually recruit the musculature above and below the joint, or we may have delayed healing time because that tissue is swollen, and because it's swollen, I'm not able to get the garbage out and bring the necessary groceries back in. So anytime where we can get motion or movement in the tissue system without motion, we tend to see people do better. And in this situation, I'm able to keep my brain plugged in. And one of the games we play around the knee, for example, is that we try to get our athletes to actively contract with the muscle stimulation. So in this situation now, I'm getting evacuation of the fluids around the swollen joint, which at the very least, even if I'm a surgical candidate, has done two things for me. It's given my brain some relief, and I've also kept the brain connected to the joint. So after surgery, it's going to be able to be recruited much more quickly. I don't have to do a whole bunch of quadricep reintegration activation exercises, and I'll have a tissue system that's less effused or less swollen. So it's in a better state where it's likely to have a better healing outcome. So that we don't go in with a lot of swelling, we go in with as minimal swelling as we can, minimal effusion as we can, and then guess who appreciates that? Everyone. The patient, the surgeon, the physical therapist on the other side. So when we know we've got some acute challenge or strain to a tissue system, we don't think, hey, there's nothing we can do. Immediately, we want our patients and athletes to be as active as they can, and H-Wave is the gateway to more active and complete recovery.